My name is Dr. Tarek Fathey. I'm the Chief Operating Officer for Mediclinic Middle East. Mediclinic Middle East is a part of Mediclinic International Group. We have divisions in Southern Africa, in Switzerland, and in the Middle East here we have in UAE. In UAE specifically, we have 7 hospitals and 20 medical centers. And if we focus more in Dubai, we have 3 hospitals, we have 2 daycare centers, and we have 8 medical centers in the community. When we talk about health tourism, there are different categories where people seek health tourism. There is the one where they don't have the service in their own countries, and that's normally related to the tertiary care. And we are fortunate to have a lot of these tertiary care services, starting from our comprehensive cancer center at Mediclinic City Hospital, and that was established in affiliation with our Hirsch London group in Switzerland, where we actually share multidisciplinary team approach. We do case review, sometimes we do actually protocol review and second opinions for certain patients. We also have our organ transplant at Mediclinic City Hospital in Dubai Healthcare City, and that was the first program in Dubai in the private sector. We also have our robotic knee replacement, which is a big center also in Mediclinic in Dubai. So those services for tertiary care, normally what attracts health tourism. There are other, which is, you call it wellness, which is the preventative health, where people actually would like to check up during the visit of Dubai, and that's also we focus on. We have a very good package for health checkup and preventative and health and wellness. And the last, which is actually for chronic patients who happen to be and they like Dubai is very well positioned as a tourist destination. So those people, especially, for example, renal failure patients, they would love to enjoy traveling. So we do a package which we call it holiday dialysis package. So we work with a lot of travel agents. So those patients actually, before they come to Dubai, we establish a program for them which fits their program. So they come here, they enjoy the beach, they enjoy the sun, they enjoy the desert, and in between we fit actually their dialysis sessions within Mediclinic. So these are the areas where we position ourselves to support the medical tourism. Dubai was always positioned as always one of the first mover when it comes to technologies and when it comes to smart government. The technology infrastructure here is one of the most advanced in the region, and definitely Mediclinic need to always be in line with the government strategy of in Dubai. And we are so proud to have a lot of new technologies introduced in Dubai, and Mediclinic was the first mover. Giving some examples, in our comprehensive cancer center, we have what we call it respiratory gating for radiotherapy. And this actually creates a totally different level of safety for cancer patient when we do the radiotherapy treatment. So it becomes very precise when the patient actually breathes, the tumor normally move. But with this new technology and software, it makes it more precise, so it doesn't actually damage the tissue surrounding the tumor. So that's one of the technology. We were the first to implement actually a robotic knee replacement as well in the UAE and the Middle East. We were the first mover with a robotic knee replacement, and the outcomes was fantastic. We also introduced the latest version of what we call it a Da Vinci, which is a new surgical robot also, which helps surgeons to do minimal invasive surgery more precise. The recovery is much better. They can access very difficult situation which wasn't able to do through a normal laparoscopic surgery. So this is an example of some of the new technologies which we have it available here, and it definitely attracts medical tourism. And that's where we position Mediclinic as a unique service provider for medical tourism. During the pandemic, Mediclinic, our priorities were to actually ensure a safe environment, not only to the patient, but also to the staff, to protect the healthcare workers to cope with the pandemic. So that was actually our priority. At the same time, we also tried to increase the access points to our patients by introducing telemedicine, by providing pharmacy home deliveries, by providing also home care to those chronic patients. So all this access reduced definitely the need for patients to leave their houses. But at the same time, those who have to come here, we made sure that there is a proper guidelines and infection control criteria to ensure it's a safe environment during their visit. Start from temperature check, start from a small questionnaire, from negative pressure rooms in waiting areas and inpatient rooms. So all of this actually were good lessons and good practices we implemented across Mediclinic Middle East. Pre-COVID, Dubai had a strategy to develop the medical tourism. Dubai was very successful in other aspects when it comes to tourism, from leisure to conference tourism, and we started a strategy to develop a medical tourism. And that was with the success of Dubai positioning themselves for leisure and conference. And I think post-COVID now, Dubai is in a much better position to develop actually the medical tourism. The COVID actually proved that the healthcare system in Dubai, and that actually was a very, very good test for Dubai healthcare system. The time we took from actually announcing the national program for disinfection and to the reopening and success was one of the lowest mortality rate of COVID. That actually brings us to a very, very solid healthcare system. We can cope with a pandemic. We managed to control the pandemic in a very short time. We managed to bring trust and confidence to the public that the healthcare system can deal with such a pandemic with so many critical cases at the same time. So we have the infrastructure. So I think the pandemic actually gave the best accreditation to Dubai healthcare system that we are in a better position. You come to Dubai, you don't only enjoy the leisure, the nice weather, the beach and the desert and the luxury hotel, but you are guaranteed a very solid healthcare system, and we are so proud to be a part of this.